Joining us right now is Doug Holtz-Eakin. He's the president of DHE Consulting. He is also the former director of the Congressional Budget Office, as well as former chief economist on the White House Council of Economic Advisors, and was a senior policy advisor to Senator John McCain during the 2008 presidential race. Doug, we were just talking about the CBO, and I'm not sure if you heard that conversation.
Yeah, I did.
You want to weigh in on where you think the CBO is on its measures of both what it sees in the Senate right now and the bills that are moving through the House?
So here's what I think is the key piece of the two reports that came out. When it put out its report in the House bill, it said the new entitlements growing at 8% a year, and the financing of it growing at about 4%, doesn't add up and doesn't bend the cost curve. If you look at the Senate finance bill, it says it's got new entitlement spending growing at about 8% a year, and instead of 4% on financing, it gets more out of Medicare and these taxes on Cadillac plans, so they think it adds up. But it doesn't bend the cost curve. We have new entitlement spending growing at the same rate in both these bills. That's the fundamental concern, because this does take place in the context of an extraordinary explosion of public debt. Looking forward, the administration's plans say we'll be running a deficit of $1 trillion 10 years from now, and that $1 trillion deficit is largely because, even though tax revenues have recovered, we're spending too much. So I'm very nervous about a new bill that creates spending at 8% growth a year in the context of a budget that's fundamentally out of alignment.
Doug, it's Peter Roskam. Thanks for coming on. Let's extrapolate out of debt generally. Can you just give some insight? You know, it seems to me one of the cumulative talking points that everybody's mentioning these days is it took 43 American presidents from George Washington to George W. Bush to acquire $5 trillion in debt. This administration will double that in 5, triple that in 10. What's the long-term prospect on that? What does that mean to us?
Well, this has been a concern for a long time. It's become magnified in recent years, and what we're doing is we're eating away at the core of the ability of the economy to grow, the saving and investment that finances new skills for our workers, new technologies for our firms, the bricks and mortar investments that firms need to make. And if we do that, we will leave behind an economy that's appreciably weaker than the one we're in right now.
Doug, this is Rob Andrews from New Jersey. It's good to see you again.
Good to see you.
Do you agree with the proposition you can't get this debt explosion under control without restraining health care costs?
One of the reasons I'm skeptical of the bills we've seen so far is we don't really do that.
I understand. Tell me how you would do it. How would you restrain the health care costs?
I think we ought to, quite frankly, it would be my hope that these bills don't go forward and that we step back and in a bipartisan fashion, let's go and concentrate not on writing checks for new insurance policies, but fundamental reforms to the delivery system. You mentioned some which are mentioned in the bills but aren't the core of it. We need to change reimbursements in Medicare fundamentally. We have a system that really breeds schizophrenia. We pay doctors on the basis of how much they do. We pay hospitals on the basis of DRG, so they're supposed to do as little as possible. Doctors practice in hospitals.
You do agree that changes in those practices are in both the House and Senate bills, right?
No, those are not fundamental. There are tweaks, there are demonstrations. We have not got a thoroughgoing...
Tell me what would be fundamental then.
Fundamental bundling of Medicare Payment Advisory Commission. Let's pay for an entire episode, including post-discharge follow-up in a bundled way, so there are incentives for providers to coordinate their care. That's a business model for health investment.
Doug, can you control costs if you don't stop the cost shifting of 47 million uninsured onto everybody else?
Cost shifting isn't about the cost. I mean, remember, insurance is just a financial product that shifts around who picks up the bill. Our problem is the bill grows too fast and we don't get quality for our money. That should be the focus of these reforms, not the insurance market.
Do you favor the base closure type mechanism for the Medicare recommendations out of IMAC?
We'll see. I mean, I've always been a little skeptical that Congress would actually let that happen.
Do you think we should?
Let me finish. No, actually, I think the Congress owns this program. It's a democracy. We elect our representatives to govern and make wise decisions. I think the Congress ought to do its job. We need to spend a lot less as a federal government, and we need to finance it. And Congress is unwilling to either cut spending or raise taxes at key moments.
All right. Doug, thanks.
Appreciate it.